This is uncomfortable to admit, but most blood pressure readings at your doctor's office are not accurate. And it's not because the clinic staff are careless, but because the way clinics are structured makes it almost impossible to get precise blood pressure measurements. And that matters because you may be told you have high blood pressure when you actually don't. And on the flip side, a normal reading in clinic can also miss real hypertension. And that is why everyone needs to know how to take their blood pressure correctly at home. So in this video, I want to go over 10 common mistakes people and clinics make when measuring blood pressure, and I'm gonna show you exactly how to fix them. So let's start. Mistake number one that I see all the time is measuring your blood pressure with a full bladder. When your bladder is full, it activates your sympathetic nervous system, and that is your fight or flight system, which basically increases your heart rate, and it tightens your blood vessels, which will then raise your blood pressure. In fact, a full bladder can increase your systolic blood pressure, that is your top number, by anywhere from 4 to 33 millimeters of mercury. And it can raise your diastolic blood pressure, which is that bottom number, by anywhere from 3 to 18 millimeters of mercury. And that is a big change. That number alone could be a difference between you being recommended to start a blood pressure medication or not. So always make sure to empty your bladder to get the most accurate results. Now, another common mistake I see is using only one arm to measure your blood pressure without ever checking both. In fact, most medical societies recommend measuring blood pressure in both arms at the initial visit. And that is because blood pressure is not always identical between arms. And in fact, it's actually somewhat common to have a small difference between measurements between your left arm and your right arm. But it's not normal to have a big difference. So anything bigger than 10 milligrams of mercury for your systolic blood pressure. And there's a systematic review and meta-analysis published in the British Journal of General Practice that noted that as many as 11% of people with high blood pressure had a difference of 10 millimeters of mercury between different arms. So that's why the American Heart Association recommends checking blood pressure in both arms at your initial visit, and then getting subsequent blood pressure measurements from the arm that gave you the higher reading. So in practical terms, you don't need to measure your blood pressure in both arms every time, but you should do it at least once every few months. And then if there is a discrepancy between the two readings, you just go with the arm that gives you the higher reading moving forward. Now, as a side note, if your readings on one arm keep being 10 points higher than the other, well, that usually warrants an evaluation with your doctor to make sure that you're not having any vascular disease or any narrowing of your blood vessels, like in your subclavian or your brachial arteries. All right, mistake number 3 is not properly positioning your body during measurements. So in order to get accurate results, we need to be in a position where your feet are flat on the floor and your legs and your feet are not crossed. And we need to make sure that we're sitting in a chair that is supporting your back. And that back support is extremely important because measurements taken without back support can increase your systolic blood pressure by anywhere from 5 to 15 millimeters of mercury. Now, mistake number 4 also has to do with the positioning, but this time it's the positioning of the arm. So the arm that we're using to check your blood pressure needs to be fully relaxed, and it needs to be supported on a flat surface like a desk. And the middle of the cuff needs to be positioned at the heart level. And there was a recent randomized control trial that showed that a lot of the common positions that are often used at home or in the clinic setting can be incorrect, and they can lead to substantial overestimations of blood pressure readings. So if your arm rests on the lap, both systolic and diastolic readings can be artificially high by about 4 millimeters of mercury. And then if your arm hangs unsupported at the side, well then at that point your systolic blood pressure may be overestimated by as many as 7 points. Okay, the next mistake has to do with the proper preparation before you measure your blood pressure. And that's because blood pressure does not settle instantly. In fact, any recent movement or stress or activity activates your nervous system. So your heart rate rises and then your blood vessels constrict. And if you sit down and measure right away, well then the reading often comes back higher than what your true resting blood pressure is. So before measuring, we need to sit quietly for at least 5 minutes with our back supported and feet flat on the floor. And during that time, we should not talk or text, just breathe normally. And that short rest lets your nervous system settle, and that's how you get an accurate reading. Okay, another common mistake is checking your blood pressure right after you have caffeine. The general recommendation is to avoid caffeine at least 30 minutes before measuring your blood pressure. Now, that's just a guideline, not a hard rule, because different people metabolize caffeine differently. And the blood pressure response depends on whether you're a habitual coffee drinker or if you drink it just occasionally, as coffee or tea may not affect your blood pressure as much if you drink it daily. Also, some people metabolize caffeine much slower than others, but in general, waiting at least half an hour after caffeine is enough to get an accurate reading from most people. And in addition to caffeine, we should also be careful with the timing of alcohol. Alcohol has this weird biphasic effect on your blood pressure. So if you look at this Cochrane meta-analysis, having 3 or more alcoholic beverages lowers your blood pressure for up to 12 hours after consumption, but then it increases your blood pressure for 12 to 24 hours afterwards. Now, you don't need to know all these time intervals. Just know that if you recently had alcohol, like over the past 24 hours, well then your blood pressure readings could be inaccurate. Now, another common mistake is using the wrong cuff size. And this is probably one of the most common reasons for getting an inaccurate blood pressure readings at home. And here's how it works. Blood pressure cuffs, they work by applying pressure around the arm until blood flow in the artery is temporarily occluded. And if the cuff is too small for your arm, well then it takes more pressure to compress the artery, which artificially raises that reading and makes your blood pressure seem higher than what it actually is. And on the flip side, if the cuff is too large, well, then the opposite can happen. The readings can come back falsely low, which is just as concerning because it can give you false reassurance. So here's a simple and practical way to make sure that you're using the correct cuff size. So what you want to do is wrap a tape measure around the bicep about halfway between your shoulder and your elbow. And then you measure the arm circumference, and that number will help you determine which cuff size you need. Inside the cuff is an inflatable bladder, and the ideal cuff bladder length should cover up anywhere from 75 to 100% of the arm circumference, and the bladder width should cover up 40 to 50% of the circumference as well. Now, another important point is the cuff needs to be placed on the bare skin, and if you have clothing that has sleeves, well, we don't want to roll up those sleeves because that may create a tourniquet effect to where it squeezes the blood flow and it messes up the measurements. Alright, the next mistake we want to avoid is making a diagnosis based on a single blood pressure reading instead of looking at trends. Because blood pressure is not a fixed number. It changes constantly throughout the day based on stress and your sleep and your activity and what you ate that day and even breathing. So one reading or even 2 or 3, whether high or normal, does not tell the full story. What matters are the averages and the patterns over time. So here's a simple protocol to do this accurately. If you're just starting out measuring your blood pressure, so for the first 2 weeks, check your blood pressure daily and measure it 3 times per day. And at each session, take 2 readings, ideally in different arms, taken 1 minute apart. Now, this may seem cumbersome and excessive, but those 2 weeks will give you enough data to see what your blood pressure actually looks like at your baseline. And after that, if there's concern for high blood pressure, well then you just keep checking 2 to 3 times per week for the next few months, and then adjust the frequency based on your progress. And if your blood pressure is normal, well then you can just space it out to once a week or once every 2 weeks, depending on your overall health profile. We usually try to do it more frequently if there's any concern for insulin resistance, so things like diabetes or prediabetes, or if you have any kind of risk factors for heart disease or strokes. And as the data comes in, we use those averages as opposed to single blood pressure readings to guide our decisions on our diet and our exercise and medications. And finally, I'm noticing wrist blood pressure monitors are getting more and more popular, but at this point, I do not recommend them for my patients. I would encourage you to use an upper arm cuff if possible. Now, there are some wrist devices that have been validated in controlled settings, but they come with important limitations. The sensor in those blood pressure monitors must be positioned directly over the radial artery, which is very hard to maintain. And then the wrist must be held precisely at the heart level. So from a practical standpoint, that positioning is very hard to maintain and reproduce, which makes your day-to-day measurements very unreliable. In fact, there was a population-based study that looked at over 700 subjects, and out of those subjects, 86% of them had an error of at least 5 millimeters of mercury, and 63% of those subjects had a measurement error of at least 10 millimeters of mercury. So the only time I would recommend a wrist device if an upper arm measurements are just not feasible. Now, if you're checking your blood pressure and you're noticing that they're running high, well then I would definitely discuss that with your doctor. And also check out these videos I made on how to use food to lower your blood pressure naturally. I hope this was helpful. Stay healthy, and I'll see you in the next one.